In American healthcare, a little-known but powerful group shapes your preventive care: the U.S. Preventive Services Task Force, or USPSTF. This independent panel of 16 volunteer medical experts reviews scientific evidence and recommends which preventive services, like cancer, screenings, and blood pressure checks, work best. Their recommendations matter. Under the Affordable Care Act, most private insurance must cover A and B rated services at no cost to you. That means no copay, no deductible, and no co-insurance for millions of Americans. For years, the USPSTF was trusted for its rigorous, evidence-based approach, free from political influence. But recently, a new debate has emerged, not about the science, but about the framework the task force uses to make decisions. With a growing focus on diversity, equity, and inclusion, some now question whether the USPSTF is still guided solely by evidence. Has the task force started to prioritize social goals over scientific objectivity? This question is now at the center of a national controversy. The USPSTF has begun integrating a health equity framework aiming to address persistent disparities in health outcomes among different populations. Supporters say this evolution is necessary. Medicine can't ignore the social and systemic factors that shape health, like racism and poverty. The task force now considers how preventive services impact specific groups, tailoring recommendations to close gaps in care. For example, a recent guideline encouraged doctors to provide extra breastfeeding support for Black mothers, acknowledging historical trauma and its effects. Advocates see this as compassionate and essential for closing health gaps. Critics, however, argue that focusing on social context over clinical evidence risks turning medical advice into ideology. They worry this shift could compromise the scientific integrity that made the task force so trusted. The debate isn't just about recommendations, it's about language too. The USPSTF now uses gender-neutral terms like pregnant people to include transgender and non-binary individuals. Supporters call this inclusive and necessary for equitable care. Critics argue it's confusing, imprecise, and a sign of political influence over science. They fear that changing language could erode trust and clarity in medical guidance. This linguistic shift has become a flashpoint, with some accusing the task force of prioritizing social trends over evidence-based communication. The controversy over words reflects deeper concerns about the task force's direction. Critics believe the USPSTF is drifting from evidence-based medicine by weaving in diversity and equity frameworks. They worry that tailoring recommendations by race or identity blurs the line between science and social engineering, risking reverse discrimination and undermining personalized care. Some fear resources could be allocated based on group identity, not objective medical need. Supporters counter that ignoring social context isn't neutral, it perpetuates health disparities. They argue that evidence-based medicine should include data on health inequities to create more effective interventions. For advocates, this is an ethical imperative. Medicine must address the full range of factors influencing health. They see the health equity approach as expanding, not abandoning scientific rigor. The goal: ensure every American has a fair shot at good health by breaking down barriers to care. The divide is deepening, with both sides claiming to defend the integrity of medicine. This debate isn't just academic, it affects every American with health insurance. USPSTF recommendations determine which preventive services your insurance covers for free. If a service gets a high grade, it's covered. If not, you might pay out of pocket. The task force's evolving philosophy directly impacts your access to care and your wallet. The controversy raises big questions. Should guidelines be based only on clinical data, or also on social and historical factors? The stakes are high. Recently, the health secretary even considered dismissing the entire panel. Whether you see the task force's new direction as progress or a risk, its decisions will shape the health of millions. This is more than a policy debate. It's about the values at the heart of American healthcare.